Hey guys, my name is Bonnie Perry and I'm a speech language pathologist, and I thought we would just have a very candid talk about children developing. It's every parent's question is, how do I help my child develop properly so that they can have success in life? Well, there's a ton of things to consider and a ton of books to read and a ton of blogs to follow and a ton of YouTube videos like this one that you found to watch. But I'm going to go over something that may not have been addressed as well, and that's the mouth. A child's mouth develops differently, and we have to keep an eye on that, but we're not experts in that, so I'm going to give you a few things to look out for. So I'm a speech pathologist. I work with all things mouth related, and that's eating and drinking. It's speech as far as when they're able to talk, how they're able to talk, if they can make those sounds and produce words. It's the stuttering. It's all the components. And then I'm also an expert on myofunctional therapy, myofunctional disorders, and that's when the tongue is not toned, it's weak, and they have a hard time growing the appropriate mechanisms for their mouth. So, what can that look like? It can look like difficulty in feeding when they're babies, and maybe a hard time latching. Maybe they have a tongue tie removed when they're babies, and that helps a lot. Or maybe they don't. Maybe they keep on growing and they have a hard time eating. They're picky eaters, and they prefer certain textures. Does this sound like it applies to you? Maybe they're messy eaters. They get food all over their face. Maybe they're thumb suckers. And how do we stop them from being thumb suckers by the time they're ages 3, 4, 5? And what does that look like for them? Does their tongue start thrusting forward, developing that tongue thrust whenever they're eating or drinking? Do they slurp? Are they making the S sound with their tongue out in front in between their teeth? These are all things to consider, and if you are seeing any of those signs of struggle within your kids, then I'm the one that can help. We have to target this when they're young, because although it's really hard to take the thumb sucking away from a kid because it's a soothing mechanism for them that helps calm them down, their little anxious bodies that don't understand how to operate in this big, strange world to them, but we have to figure out ways for them to soothe themselves without altering their mouth, because that thumb is just going to push up on their palate. It's going to change the way their palate looks, meaning expanders and some more pain along the road whenever they're teenagers. Or you might end up with fingers like me that end up always twisted because I suck these two and now they're stuck all crooked. Maybe their teeth are crooked. Maybe their mouth is open all the time because they're breathing through their mouth and their tongue is low on the floor of their mouth. These are all things to look out for, because over time, this causes a lot of problems. It will cause the face to grow laterally. It will cause the mentalis to have a hard time, this muscle right here, have a hard time meeting the lips. The mouth will automatically hang open, and they will have to breathe through their mouth, which means that their airway is going to grow in a restricted way. Their airway might be a lot smaller than the space that we want them to have because their posture wasn't correct growing up, because when they were sleeping, they were fighting to get that air, so they contorted, they twisted, they were restless, and it made their airway develop in a way that doesn't get enough oxygen to them. Maybe they are an anxious little human. Maybe they're restless. Maybe they have some behaviors that happen because they just seem wired all the time, but really it's lack of sleep and the fact that they need to get that anxious energy out of them because they haven't been getting quality rest for so long. There are so many factors to cover in this sphere of knowledge, and I don't think a lot of parents know enough about it. So that's where I come in. I come in for parent coaching seminars, whether they're infants, toddlers, or elementary age kids, even teenagers. I come in, I can coach the parents. I'll look at your child, I'll see what they're doing, and I'll guide you in some tangible ways, some methods to help them stop. Maybe it's finding other solutions for the thumb sucking habit. Maybe it's helping them increase their food inventory from 10 foods to way more so that meal times are more enjoyable for the family. Maybe they're teenagers and they're experiencing jaw pain, jaw clicking already, TMJ issues. Maybe you notice that their tongue is still thrusting forward and they're teenagers and you don't want them going another year in high school with a lisp. Maybe you want help for that. And I'm your guide to go to for any of these concerns. I have my own myofunctional therapy clinic and can be all virtual so that anywhere you go, you can have me by your side to help you out. So message me below, ask me any questions. I'm always happy to do my best to help. I want to be your brainstorm buddy in order to fix these issues. And after you spend some time with me, you become a Mastermind yourself. So message me below. Thank you for your time. I hope you learned a little something to watch for, the little signs to watch for as your kids develop, because I too want them to develop the best that they can. Thank you. Bye.